Hello everyone, and welcome to another episode of Lifestyle Matters. And once again, we have the good Dr. Savina with us. Hello Savina, how are you?
Good, thanks, Virgil. And yourself?
I'm great. So I thought today we'd discuss low carb diets. Now, before we launch into the why and the how, I think we need to understand the what. So first of all, what is the generally recommended Australian macronutrient ratio according to the Australian dietary guidelines?
So the current recommendation for our carb intake is about 45 to 60% of our, 45% of our daily calorie intake. This equates to about 200 to 300 grams a day of our carb intake. And that's what it is.
So a low carb diet is really, technically speaking, anything that's less than 45% of total calories. And I suppose we need to also understand the other macronutrient composition. So the Australian dietary guidelines suggest that we should be having about 15 to 25% of our diet as protein and 20 to 35% of our diet as fats, but with a 10% maximum for saturated fat. So the thing about a low carb diet is that you also have to then increase the other two nutrients. So when you're dealing with low carb, you've also effectively got high protein or high fat, haven't you, Savina?
That's right. And that's what people sometimes call the low carb, high fat diet, which is,
Yeah,
sometimes people know it as the Atkins diet,
yeah,
which was
yeah.
quite famous once upon a time. So just going further into the low carb diet, there are different, you pointed out, anything less than that carb intake is basically considered low carb diet. But there are actually different categories of low carb diet. So there's the very low carb diet, which is about 20 to 50 grams of carb intake a day, which is almost ketotic in nature. And that is something what they call almost like the keto diet, which we'll go into the next episode. And then they've got the low carb diet, which is about 130 grams a day of carbs, and a moderate carb intake, which is less than 230 grams of carbs a day. When you think about it, having 20 to 50 grams of carbs a day is actually hard work. And to try to do it over 12 months is actually pretty hard. And that's one of the reasons why they actually say that the low carb diet is not sustainable after 12 months. There have been lots of research and studies going into that. Would you like to elaborate into that, Virgo?
Well, there's a lot of research demonstrating the lack of compliance over time. And so people start out rigidly adhering to what they define as low carb, the 25 to 50 gram per day. And then over time, they have measured the actual carbohydrate intake of people who say that they're still adhering to the low carb diet. And the carbohydrate values are 150 to 200 grams a day. It's really, really difficult to adhere to. And the evidence of benefit for low carb, high protein diets or low carb diets in general is really limited to studies of maybe 12-week duration. And really, once you get to the 2-year mark, there's absolutely no difference in terms of real life practical outcomes, in terms of clinical parameters between low carb diets and any other diet for that matter. But take us through the history of low carbs, and when did it start, and for what medical condition was it first developed?
Yeah, so that was actually, it started around in the 1930s, when diabetes was really identified just a few years before that. And, every diabetic was placed on a low carb diet. And that actually was happening because it showed that people were on low carb diets, they lost weight, insulin resistance improved, their average sugar readings, which we commonly know as HbA1c, was improving, and their heart disease risk was also improving. But once again, over years of studies, they found that, as we alluded to, this is not actually a sustainable thing. And in fact, there were other potential issues around sticking to a low carb diet, something along the lines of where people have hypertriglyceridemia with high cholesterol. Take us through that, Virgil. What were the
Yeah.
issues around that?
Well, primarily, if you're dealing with low carb, I've also alluded to the fact that low carb means high everything else, and that includes high fat. So if you're unlucky enough to have some form of familial hypercholesterolemia where your triglycerides are too high, you can develop pancreatitis as a result of that, especially if your triglycerides go above 1,000 milligrams per deciliter. So, you want to be actually minimizing your fat intake. And so really, there are certain medical conditions for which a low carb, high fat diet is really contraindicated. And that's just one example. But, going back to this idea of how low carb diets helps with insulin resistance and sensitivity and with diabetes. So I suppose when we're talking about low carb diets, we really need to understand why it was seen as a very attractive option for people with diabetes. So remember, the key hallmark of diabetes is basically, or certainly type 2 diabetes, is insulin resistance. And hyperinsulinemia is actually triggered by carbohydrates, also some proteins. So the more carbohydrates that you eat, the more insulin that you need to produce. But if you've got a situation of insulin resistance, you need even more insulin to be produced. So the idea that you can minimize carbohydrate intake to lower the stress in the pancreas and to reduce the amount of insulin that needs to be secreted can only be seen as a good thing certainly in type 2 diabetes. One of the other issues is that as we put on weight, we then develop further insulin resistance, which then contributes to the stress of the pancreas. And so because the low carb diet was associated with weight loss, then that was also seen to be treating insulin resistance. However, it goes back to the longevity point that we're trying to make, that over time, the lack of adherence means that actually it's very difficult to maintain this diet and very difficult to maintain the benefits. But that's kind of low carb, high fat diets. Now, we do have low carb, high protein diets. And one of the things that is said about low carb, high protein diets is not only have you got the effect of low carbs, so you've got less insulin and you've got less less weight gain. You've also got, with high protein, the thermogenic effect. So high protein diets cause a lot of satiety, and actually the ability of the body to digest protein is dependent on burning more energy. So there's the thermogenic effect.
Yeah, and also just to add to that, the protein also, if you remember from one of the few episodes we talked about, the more protein we eat, the less of a high insulin spike it produces. So that was also one of the reasons to improve that.
So when we're talking about, what is a low carb diet, we've agreed that it's lower than the 45% threshold for the standard range of carbohydrates. We've talked about that's what it is, but what does it look like in practice? In terms of actually making meals, how do you see the low carb diet?
Yeah. Before we go into that, Fergal, how you were talking about diabetes and low carb, I just wanted to bring to raise this. There was a trial called the Look Ahead trial that was basically a trial it's for action for health in diabetes. So this trial was actually to look at the differences between someone on an intensive lifestyle regime, where they want a carb restricted exercise sort of a regime, and those who were on a purely diabetes support and education, the usual way. The primary outcome of the study was basically insignificant because it showed that people benefited from both arms of the study, whether they were on an intensive lifestyle regime or whether they were on the diabetes support. But what they found is that both groups, the end result was their calorie intake was markedly restricted, and their idea was to keep their fat intake to less than 30% of their total intake, and to also minimize carbs, refined carbs. And if they actually looked into it, more people were actually eating more whole food processed carbs, and cutting down the less processed. So they're eating things like pumpkin, potatoes, sweet potatoes, the things that we advocate for, the complex carbs. So I guess the main point I'm trying to make here is carbs were actually, once again, not the enemy, because people were eating complex carbs and yet reducing the calorie intake and losing weight, and their diabetes was still well controlled.
So really what you're saying is it's refined carbs that are the enemy.
Yeah.
Which goes back to our general principle of what is a lifestyle diet. It's It's a diet that is a whole foods, non-processed diet with lots of grains, lots of multicolored vegetables. So refined carbs are the enemy. And also the other thing to point out is actually that fat is not the enemy. It's saturated fat is the enemy. Trans fats are the enemies, but the MUFAs and the PUFAs and the oils, they are not the enemy.
That's correct. So I guess going back to your question about what does a day-to-day diet of a low-carb, high-fat diet looks like, basically, once again, it comes down to, minimizing your potatoes, your starches, eating less bread, pasta, rice, and eating more vegetables and meats. And they were getting most of their calorie intake from eating meat and fats, as what you were saying, saturated fats essentially. And unfortunately, that would have led to other complications if they had high triglycerides. Even people with pre-existing fatty liver disease, they would also not benefit from a diet like this because they're further overloading their liver with even more saturated fat. And that's the diet that most people follow, unfortunately, which do have certain implications. In fact, there's also been some, these are all still things that are being looked into, studied, but there is question whether going on a low carb diet, because it produces almost a ketotic state, an acidic state in your body, does it actually increase the risk of osteoporosis? They have seen this, they're obviously researching this in rats, animals essentially, but there's potentially that because they've noticed that there's a lot more calcium being excreted through the urine of these animals. Are these things happening to humans? They're looking at that. The other thing is you get a lot of minerals and vitamins like your dietary fiber, your magnesium, your phytochemicals, which you can get quite a bit of in unprocessed carbs. But if you limit all that, you might be deficient in that, and instead you're having more fat. That means more red meat. That means you're increasing a risk of other potential cancers. So there's all these other potential risks of just being on a low carb, high fat diet. That's being
It does
found.
sound, however, that we are quite dismissive of the potential benefits of the low carb diet. I feel that we need to put some balance into this discussion so far.
Well, I think it's great for a year.
There are very ardent advocates of the low carb diet. So we do need to kind of understand why is there such support. So I think firstly, there is this physiological idea that it does reduce the strain on the pancreas, it reduces the amount of insulin that needs to be secreted, and it does contribute to weight loss if it is adhered to, and it does reduce cholesterol, doesn't it? It does have these effects, these downstream effects of reducing cholesterol, reducing LDL, reducing VLDL, and it does help with fatty liver. You can use, so long as your low carb diet is also hypocaloric, then you are going to lose weight and you are going to get these downstream benefits, aren't you?
Yeah, and that's what, all those very famous weight loss programs. Jenny Craig, for example, was one of them who advocates for the high protein, low carb diet.
So, Savina, what I'm hearing is that there are proponents for the low carb diet. If you adhere to it and if it is hypocaloric, it does actually contribute to a weight loss pattern. But it is difficult to adhere to. It does have some effect on lowering cholesterol, reducing fatty liver, reducing blood pressure, reducing insulin resistance. But the benefits are there's no evidence base for the prolonged effect or the prolonged beneficial effect, at least over 2 years. And it really does deviate away from the concept of a balanced whole food plant-based diet full of rich, complex carbohydrates. But I suppose this discussion has been useful to identify the fact that actually, fat's not the enemy, carbohydrates are not the enemy. It's actually saturated fat and refined carbohydrates that really we should be minimizing.
And I think in the end, we just have to remember that it is whatever is said and done, there is plenty of research to say it is beneficial for the first 12 months. So
yeah,
I guess, if it suits your lifestyle, go for it, I guess.
Go for it. If
that
it
would
works
be
for
my,
you, go
yeah,
for it.
Yeah.
All right, Savina, well, thanks very much for your pearls of wisdom today. I look forward to the next episode, and we'll speak soon. Thank you.
Thanks, Michael.
That's all for today's episode of Lifestyle Matters. My name is Dr. Fergal Armstrong. Thanks for watching, and we'll see you next time.